Hello students, welcome to my biology class. Today I will be discussing an important topic, that is infertility and assisted reproductive technologies. This discussion is a part of your chapter 4, that is reproductive health. This chapter is from class 12. So today let us discuss the topic infertility and assisted reproductive technologies. Before we start the discussion, let us first know what you will be able to do after completing this session. You will be able to know and write the causes of infertility. You will be able to give guidance when a person should see a doctor to treat infertility. You will be able to discuss the advancement made to have child through ART. Discuss the problems associated with ART. So these are some of the areas which we will be discussing, and you will develop the abilities. Now, perhaps you are already aware that a large number of couples all over the world, including India, are infertile. What is this infertility? Infertile means that they are unable to produce children in spite of protected sexual cohabitation. So they do not have children. Now, why they do not have children? Apparently, both looks normal. Reasons for this are many. Some may be physical, some may be congenital diseases. It can be due to drug, or it can be immunological, or even psychological. So these are some of the broad areas which accounts for the infertility. However, it is very difficult to make infertile ones to fertiles, but the infertile couples may be assisted to have children through certain special techniques, and these are called as assisted reproductive technologies. So in case where the couple fails to obtain child by normal means, there are other means by which they can have children, and that is what we are going to discuss today. Let's start with infertility, because when does a person adopt for ART? It is then when the, there is infertility cases, and after several trials the couples have failed to obtain a child. So under that circumstances, it is wise to opt for ART. So now first let us understand infertility. So first discussion is how to diagnose infertility. As a matter of fact, in our family, the senior members in the family starts expecting a newborn member, starts expecting the new couple should have a child as soon as possible. So as soon as the marriage is over, the elders start expecting that maybe within a year they will have a new members in the family. In many cases, the couples do not have new members, they do not have children within 1 year. For this, there are many reasons. It may be due to a deliberately planned, they might have planned not to have children so quick, and this information is not with the parents or the senior members of the family, due to which it starts creating anxiety. It may so happen that the couples had been trying to have a child for the last 6 months, but they met with failure. If it so happens, then it is really a time to think. First of all, the cause of failure must be a matter of discussion between the two members of the couple. and find out the possible reason. Then they should consult a medical specialist who will diagnose the actual problem and finally give a possible solution. So, this is how we are to start. Now, let us understand infertility in males and females. What are the causes? By default, what happens is whenever a couple fails to have a child, the woman is directly blamed for it. This is common practice. But as a student of biology, you must know and also try to preach the same, that it is wrong to blame a woman immediately without understanding the reason. So, infertility is not applicable. This term does not apply to women only. It has been found that infertility cases, after a survey, it has been found that one third of the infertility cases are due to certain things lacking in the men. One third of the cases are found in the woman, and one third is due to both, means both together. So the responsibility of infertility is shared one third by men, one third by women, and one third by both. Infertility in males may be due to several reasons, like it can be due to low sperm count, abnormal sperms, or even improper or failure in the delivery of the sperms. There may be more reasons. For now, we are discussing only a few points. It may be due to disorder in the ovulatory process in the females. This disorder in the ovulatory process may be due to some hormones. It may be due to blockage in the fallopian tubes. It may be many others. Other than these, there are several causes. Chemotherapy and radiation is known to affect both males and females and may cause infertility. These are some of the reasons, and these are not the only reasons. So it is better that if a couple finds failure or meets failure even after 6 months of continuous trials, then it is advised that they should see a doctor and understand the problems. Now, when should a woman consult a doctor? Any woman of about 35 years of age and trying to conceive for the last 6 months or more, often missing her periods or having irregular periods, having pelvic inflammatory diseases, might have treated for cancer, or having a history of induced abortion at an early age, or have a previous history of miscarriages, or if she is experiencing pain during menstruation for a long time, then such women should immediately see a doctor and find out the possibilities. Now we come to even man may have a problem. So, when should a man consult a doctor? If the man has sexual problems, if he has been treated for testicular or prostate problems, if he has undergone any treatment for cancer, maybe chemotherapy or radiation therapy, if it is found that the person has low sperm count and is clinically tested, if he has problem with ejaculation and erection, if he has ever contracted any sexually transmitted diseases, then the person should see a doctor. Now, even after seeing the doctor, certain medications, clinical trials, if fails, then it is better that the couple accept this assisted reproductive technologies, or in short called as ART. Now let us try to understand what is this assisted reproductive technology. Now you can see this. Here we have a assisted reproduction technologies can be classified as fertility medications, means where medicines can be given to treat the problems. This part we are not dealing with. Here it is mostly the hormonal treatment. It is hormone therapies. So this part is not being dealt right now. We will be dealing with assisted reproductive technology, because when this part fails, then we go to assisted reproductive technology. Now let us consider that this part has failed. So the couple did not have children. So now the couple opts for ART. Then what are the possibilities? Possibilities are in two broad headings. One is intrauterine insemination. We'll discuss all these terms one by one. And second is in vitro fertilization. Under in vitro fertilization, embryo transfer, ICSI, and gift or ZIFT. Both fertility medication and assisted reproductive technology are helpful for any infertile couple to have a children. Let us start with in vitro fertilization. What is IVF? This process involves fertilization outside the body and then transferring the zygote. That is called as embryo transfer. Here you will come across various terms. All the processes which we have discussed of, they are not isolation. They are not in isolation. They all have relation with one another. Now in vitro fertilization, that is, fertilization takes place outside the body. Now how this will take place outside the body? In common, this is called as a test tube program. All of you you are aware of this term, test tube babies. How this is done? The ova from the wife or the donor. Now here you see, there are two options. If the wife is able to donate the ovum, then it is okay. If the husband is able to donate the sperm, then it is okay. In case anyone is unable to do so, then the gamete will be received from a donor. So a donor for the wife's ovum or the donor for the husband's sperm. So they need to be collected. So whatever be the source of the ovum or whatever be the source of the sperm, they are collected, and in the laboratory under simulated conditions they are induced to fuse and finally fertilize. So this results into a zygote as normal. The zygote fertilization, which was supposed to take place in vivo in the body, now takes place in vitro in glass vessels in the laboratory under simulated conditions. After fertilization, the zygote develops. The zygote develops 2 cell, 4 cell, 8 cells, 16 cells, and so on. So now this zygote or the embryo is transferred. Where it will be transferred? It will be transferred into the woman, or it can be transferred into a surrogate mother also. It depends upon the receptivity of the wife or the person or the woman for whom this program is being done. So these are the what we have just discussed is the process of IVF. Now let us understand what zygote intrafallopian transfer means, or commonly known as ZIFT. Now egg cells are removed from the woman's ovary and fertilized in the ovary, in the laboratory, sorry. Just now we have discussed a couple who is now infertility proved, and the woman, she donates the egg cells, and these are fertilized in the laboratory. Zygote is produced, and here the zygote is produced means a sperm is required. Whatever be the source, the zygote is produced. Now this zygote is placed in the fallopian tube. Now let me remind you of our previous chapters. We are discussing human reproduction. There we discussed what is the site for fertilization. It is the ampulla region of the fallopian tube. Right? Now, depending upon the stage of the zygote or the embryo, where you are going to transfer this. So this early embryo, now which is developed under simulated condition, will be transferred to the human body for further development. Who will be the human body? Priority is the woman who has given the egg cells because she wanted to have a child. Now, if she is not able to carry on with this, then what happens? Then, of course, a surrogate mother will be required. So now let us consider that this zygote will be transferred into the woman's fallopian tube. Then it will be called as zygote intrafallopian transfer. Now, this stage is very important. In which stage of the zygote you can transfer the zygote or the embryo into the fallopian tube? When the embryo is up to 8 cell stage, because if you again recall that in the fallopian tube the fertilization takes place, then cleavage starts. So up to 8 cell stage it is possible to continue pregnancy in the fallopian tube. After this it will pass on to the uterus, and as normal process you remember that implantation will take place and so many other steps. So in ZIFT it is up to the 8 cell stage. Don't forget this because you will be confusing with other stages also. Only up to 8 cell stage the zygote can be transferred to the fallopian tube, and this is ZIFT. You can see here, this is the original photograph of the human embryo in the 8 cell stage, how it looks. Now we come to intrauterine transfer. Again the same question. It is the embryo developed, which is again under similar condition like the previous case which you have just discussed. Same thing happens. Now these are the possibilities and conditions. When, under what condition, where to transfer. In the previous case, up to 8 cell stage, it was transferred in the fallopian tube. Now what happens? The zygote starts dividing, and these cells are now called as blastomeres. This is a product of cleavage. The blastomeres divides mitotically, or it is actually cleavage division. And if during the time of transfer, if the embryo is more than 8 cell stage, then it is normally transferred into the uterus. And this is called as intrauterine transfer. You can see this photograph. That is how the embryo will be transferred to the uterus. Now let's discuss some other terms. That is gift, and then we'll discuss zift. That is gamete intrafallopian transfer. This gamete, now you have to just break these terms. Gamete, intrafallopian, and then transfer. What is this? Here, transfer of an ovum collected from the donor. So this ovum from the donor will be transferred into the fallopian tube. Why? When a female cannot produce ovum, but her body permits or can provide suitable environment for fertilization, but she herself is not producing a gamete, means the ovum, but she want to conceive. Under such circumstance, the best way is to collect ovum from some donor and then transfer this ovum into the fallopian tube, and then the normal process of fertilization can continue. If not, artificial methods are also there. Intracytoplasmic sperm injection, ICSI in short. What is this? This is a procedure in which a sperm is directly injected into the ovum, and this is done in the laboratory condition. That means for ICSI, both sperms and eggs are collected and it is a direct injection process. ICSI is advised for such males having very low sperm counts. Now, having very low sperm count has maximum chance that there will be no fertilization. Secondly, due to very low sperm count in the previous attempts of IVF, in vitro fertilization, if the person's sperms were used for IVF and failed, that means in vivo fertilization failed, in vitro fertilization failed, in such a case, the male should opt for ICSI if he wants that his sperm should be used for producing the embryo, because it involves direct injection. So, using a microneedle, the sperm is carefully injected into the center of the egg. Now, why this is best opted? Because here only one sperm is needed to fertilize an egg. You don't require 50,000 to 100,000. Now, when the person is having low sperm count, then at that moment, you can't expect such high number of sperms, active sperms. So, ICSI is a good option for such persons. Now, even for a person if a person requires a donor, then this donor sperm also can be used for doing the same ICSI. Now here you can see this photograph. These are all original photographs. That is, using a microneedle, it will be directly injected into the ovum. Sperms are directly injected into the ovum using microneedles. Now we come to another important terms, that is artificial insemination and intrauterine insemination. I suppose in your previous classes you have studied of artificial insemination in cattle and other animals. Now we'll discuss artificial insemination in human also. As we discussed earlier in the previous slides, we have understood that infertility cases may be due to the inability of the male partner to inseminate the female, or it can be due to low sperm count, it can be due to ejaculation problem, and many others. Such problems can be easily rectified or corrected by applying artificial insemination technique. What is this artificial insemination technique? In such techniques, the semen is collected from the husband. This is the first priority. If not, then the semen may be collected from a healthy donor. So, the semen, whatever be the source, is then introduced into the vagina or into the uterus. If it is inserted into the uterus, it will be called as intrauterine insemination. Otherwise, it will be called as artificial insemination. So this is how AI and IUI, or artificial insemination and intrauterine insemination, is done. You can see here in this diagram. So by this time we have understood that even infertile couples can have children. Nothing to worry about it. Best is to consult the doctor, and the doctors will give you a way. So before I conclude, let me remind you certain things, that though there are various options, these techniques, they require high precision handling by specialist professionals and also expensive instrumentation. Though nowadays there are various hospitals and laboratories doing this job with sufficient high success, but we cannot ignore the emotional, religious, and social factors which are also some of the deterrents in adopting these methods, because in all these processes we are deviating from our normal process of giving birth to the child. Sources of the donors or the sources of the sperm or the eggs are not known, and there are many others. In India, we have a large number of orphaned and destitute children, and these children will probably not survive until till maturity, until taken care of. There are various organizations, societies, those who are trying to take care of these children. Since our law permits legal adoption, I suppose it is one of the best methods of couples, those who are looking for parenthood. It depends upon the couple which option they would consider. Here we have discussed various possibilities. We are giving you some suggestions. Whichever you like, you may please adopt and have children in your family. Let your family be complete. A house is not complete without children. A family makes or composes of husband, wife, and children. So let ART be helping those infertile couples to have children and be successful. So with this, we come to an end. Thank you very much for being with me, and I'd like to see you in the next discussion on Mendelism. So there will be a new chapter. We'll be starting there in genetics. So till then, goodbye.